everyone, welcome to our group's presentation. We are from Group 2, Course of Policy Formulation, International Undergraduate Program for Public Policy and Management Batch 2020. Today, we'll be presenting about the COVID-19 vaccine distribution strategy in the case of Thailand. Here are the names of our group members. So today we will be discussing four main points, with the first being the introduction to the current situation in Thailand, and then followed by the COVID vaccines used in Thailand, as well as the distribution strategy. And then we will also be concluding the presentation at the end of the presentation. So without any further ado, I will give the next part about the current situation in Thailand for my friend to explain.
Average number of new infections reported each day in Thailand falls by more than 6,200 over the last 3 weeks, which is 29% of its previous peak. There have been over 1.3 million infections and over 3,000 coronavirus-related deaths reported in the country since the pandemic began. During the pandemic, Thailand had also managed to control a large amount of the coronavirus outbreak and only underwent partial social distancing before being hit by the deadly Alpha variant in April. The Delta variant then hit the country when only a handful of people had been injected with the COVID-19 vaccine. Health officials rushed to increase the supply of vaccines after only vaccinating 8.3% of the population of more than 66 million.
Okay, so I'm going to talk briefly about the COVID-19 case in Thailand. In January, exactly January 13, the Ministry of Public Health announced the first case of COVID-19 in Thailand. And by the end of February, there were about 42 total COVID-19 cases. Next, we move on to March until April. In March, the first confirmed death caused by COVID-19 was announced. And in April, travel bans were made. On July, the biggest demonstration after 2014 was conducted. It was a protest about how the government acted to the COVID-19 pandemic. And then the rest, from August until December, it is basically the same as what Indonesia did. There were emergency policies to prevent the spread of COVID-19.
And so until this day, there has been 36 million vaccination administered in Thailand. And with that 36 million doses of vaccination that has been administered, assuming that every person needs 2 doses of vaccine, it already covers enough to have about 26.3% of the population to be vaccinated. During the last week reported, Thailand averaged about 600,000 doses administered each day. And with that rate, it'll take a further 24 days to administer enough doses for another 10% of the population. And as for the target, local government targets a 70% of the population to be vaccinated by September.
Okay, so we are on to the second part of the presentation, that is the rational decision-making behind the COVID-19 vaccination program in Thailand. So first, in order to make a rational decision, we must define the problem. In the case of Thailand, we take a look at the impact of COVID-19 in the tourism industry. The reason behind this is because tourism is one of Thailand's biggest streams of revenue, making up to 12% of the country's GDP. According to the recent study by Shetnak, in 2020, the number of international tourists dropped by 83%, which roughly shows how much the pandemic, with all the physical and travel restrictions, hit a toll on Thailand. So the next part of making a rational policy decision, we must identify the decision criteria. Our group summarizes the impact of COVID-19 into 2 parts. As shown on the slide, due to the decline of tourists, both domestic and international, we put the impact of the pandemic on the community as part of the decision criteria. The second decision criteria, we consider the aftermath of the vaccination program, be it the clinical side effects or the division in society due to unequal access of COVID-19 vaccination.
Okay, so now we allocate weights to the decision criteria. From the budget impact, 4.7 billion baht to procure another 9.9 million doses of the Pfizer mRNA vaccine and procure a total of 100 million doses of COVID-19 vaccines by the end of this year. The second one is the effectiveness. All COVID vaccination are approved by World Health Organization under emergency use listings, which means that they have high efficiency rate of 50% or above. And we also allocate about the side effects. The common side effects are pain at the injection site, fever, fatigue, headaches, muscle pain, chills, and diarrhea. And less common side effects are severe allergic reactions such as anaphylaxis. Okay, and the fourth one is about the severity of the disease, uh, the range of side effects, unpredictability of which side effects that will be received, impact to national economy, and ease of spreading. Uh, the last, the last word is about the cost of the vaccine. Uh, we must we must look at the cost to produce the vaccine, cost to transport and store vaccine, and also international networking and financial aid. So these five ways is what determines our decision to choosing the vaccine.
All right, after all of these factors being considered, Thailand then have to decide on its vaccination program that suits the countries best. But before delving into the strategy, the following presentation is an overview of vaccines that Thailand uses for the vaccination program.
Thailand's vaccine overview. Now, currently, the vaccines that have been approved by the TFDA are the Sinovac vaccine, the Johnson& and Johnson vaccine, and the AstraZeneca vaccine. Sputnik 5 has applied for a case, but it's not approved yet. Moderna is under consideration by the TFDA, and Pfizer has not yet applied a case for approval. Now, currently, Thailand has procured more than 5.5 million Sinovac vaccines and more than 62 million AstraZeneca vaccines. There isn't one for Johnson& and Johnson yet, for it's been only recently approved, and future delivery of it is expected by the end of 2021. Now, the doses of Sinovac vaccines delivered to date are 3.5 million, and for AstraZeneca, 117.600. Future delivery expected for Sinovac is 500,000 in mid-May, and for AstraZeneca, 6 million in June. Pfizer is expected 10 to 20 million in the second half of 2021. And again, Johnson & Johnson is expected at around the end of 2021. Each of these vaccines has a recommended age group for optimal and safe use of it. The Sinovac is for people between 18 and 59. Johnson & Johnson, 18 plus. Pfizer, 16 plus. But in Thailand, it's changed to 12 to 18. Sputnik 5 and Moderna are also 18 plus. AstraZeneca, 18 plus. However, it's 16 plus in Thailand.
Okay, so Thailand employs a mix and match vaccination plan. So basically, for the first vaccination, they will use vaccine A, for example, and the second vaccination, they will use vaccine B. So they're mixing two different types of vaccines. And for the first vaccine type, they're using Sinovac and AstraZeneca.
Okay, so the second mix and match vaccination plan will include Sinovac and Pfizer from BioNTech. The third mix and match vaccination plan will include AstraZeneca and Pfizer from BioNTech. Okay, so the government also offering booster shots to those who have completed 2 doses of Sinovac, and this booster will be AstraZeneca or Pfizer BioNTech. This booster will be prioritized to their frontliner workers who were given imported Sinovac in the early of the vaccination program. Yeah, the government of Thailand also developed an alternative, which is they sell a Moderna vaccine for 1,000 until 3,000 baht Thailand. And here is the video.
Oh my god, your update. I think you all know now that in Thailand we pay for vaccines, right? Last time I told you we paid through Shopee. It's here! Ta-da! Moderna, Form, Hospital Which Highway. And if you see, this is the review. This is the amount that they have sold, and this is the price. And you can pay by installments for 6 months. User friendly! And here you can see, you can pick the branch of the hospital you're gonna go get the vaccines and the amount of doses. If you want just one dose booster, just pay one. If you want two, then you pay two. Oh, technology!
All right, so we move on to the third part of the presentation, that will be distribution strategy.
When looking at Thailand's vaccination strategy, it's not only important to look at what kind of vaccines Thailand is using, but also how many they're obtaining and how they're distributing them across the country. And Thailand set itself 3 goals that they want to achieve with their vaccine strategy. First, they want to reduce the morbidity and mortality. They want to protect the country's health system, and they want to drive the economy and society of the country with targeting people that are at high risk, such as the sick and the old. They reduce the morbidity and mortality by targeting medical personnel and public health sector workers. They protect the country's health system, and by targeting laborers in the service sector, and especially people in the tourism sector, they make sure that the economy can still drive and can regain its old powers. Therefore, when we're looking at the distribution of vaccines in Thailand, we can see that even though the country overall does not have that many vaccinated people yet, that high percentage of vaccinated people, in tourist regions such as Phuket or Samui, 70% of the people have been vaccinated already months ago. This makes Thailand's approach to vaccination very different from, for example, Western countries. Let us now take a closer look at the timeline of the strategy to understand the distribution and Thailand's choices a little better. So in November 2020 already, Thailand first ordered vaccines, which was 26 million doses of AstraZeneca, which is, if you look at the overall population of Thailand, not even 20% of the population. So from the beginning on, they did not nearly order enough doses. Then in February 2021, they launched their vaccine program, and the first shot was given on February 28, 2021. Then in July 2021, they decided to join COVAX, which they didn't want to do before because they were afraid that they would be hindered by the organization and would have to buy vaccines at a higher price in the end. But they realized that they have insufficient vaccine supply and reconsidered that choice. In July as well, Phuket reopened for tourism because they set their goal to open tourist regions as soon as they are vaccinated, as soon as they vaccinated 70% of the population. And by that time, even though overall nationwide only 4% of the population was vaccinated, 74% of Phuket's population was vaccinated. So they started the Phuket Sandbox program and let international visitors into the country again for the first time. And then in September, where we are today, we can look at what the original plan was, which was have 70% of the whole population of Thailand vaccinated by September. and the reality, which is 71% of the population is fully vaccinated. So even though in some aspects we can say that the strategy was a success, in many aspects it also was not, and Thailand is still lacking behind on vaccinations, especially due to its insufficient supply of vaccines.
Okay, so how effective Thailand's vaccination strategy so far? Just like my friend said before, there are things that are successful, but there are also some parts that Thailand need to improve. So according to the recent survey by Reuters, there is a 68% decline of infected cases since its peak. This shows that in terms of tackling the spread of the virus, the vaccination program is very effective. However, in terms of the tourism industry, Thailand Tourism Authority reported that the amount of international tourists is still 82% lower than before the outbreak. Although there is a 1% increase from last year, Thailand still has a long way to go when it comes to repairing the damage caused by a huge slump of tourists due to the pandemic. And in this case, the only time could tell how or when Thailand could rebuild its tourism industry back.
In conclusions, as of today, 1,322,519 people have contracted the COVID-19 disease in Thailand, of which 1,166,364 people survived it, while 13,500 people died. Thailand uses 3 types of mix and match vaccines, the first being Sinovac AstraZeneca, the second Sinovac and Pfizer-BioNTech, and the third AstraZeneca and Pfizer-BioNTech. Even though the goal has not been reached yet, Thailand aims to vaccinate 70% of its population by September 2021. However, until now, only 17% of the population has been fully vaccinated. So although Thailand has not reached the target numbers, the vaccine strategy in Thailand has been effective so far. And vaccination will restore the ability of foreigners people to travel to Thailand, as tourism accounts for about 11-12% of the state's total GDP.
So, what recommendation can we give for Thailand in the future? First, centralization of vaccine is not only in the capital city but in other cities as well. Second, open to others vaccine option. Do not only use 3 vaccine only. As we mentioned earlier, Thailand only used Sinovac, AstraZeneca, and Pfizer vaccine. Maybe in the future, Thailand can be more open to the other types of vaccine such as Moderna or others. Third, create a zone cluster per vaccine region. For example, if 50% of the area has been vaccinated, can be categorized as a safe zone or maybe green zone. Fourth, make sure every activity needs vaccine, such as entering the mall, travel, and others. This can encourage people to get vaccinated. And last, cooperation and open with foreign parties for the availability of vaccine.
All right, so here are the references and sources that we use for this presentation. And that is all for our group's presentation. Thank you so much for your kind attention. Have a good day.